Hola, buenos días a todos, buenas tardes. I'm going to speak in English just to make sure that everybody understands and they are able to respond. We are very happy to have this important panel with us. Everybody is working, trying to promote the intersection between climate change and health and specific action by health systems and healthcare facilities. So I will be moderating this panel, and maybe I will start by asking Hector, who is sitting just next to me. Hector, maybe the first question. Can you tell us a little bit on where Spain is in terms of action by the national health system in reducing their own emissions? Is something that you've started to work on, or is this something that you are thinking now and planning to do?
Okay, so thank you for the question. I'm Hector Tejera. I'm working in the Ministry of Health in Spain. I'm the head of climate and health right now in the cabinet of the ministry. We are working right now towards a net zero approach for the national health system. In Spain, it's kind of complicated because we have these mixed national regional levels in which most of for example, the hospital facilities is in hands of the regional health systems, and the ministry do a lot of coordination, but we have not direct management of the hospital facilities. But we are working in different roads, so to speak. So we know that the data from most countries show that the national health system is about responsible for 5% of the greenhouse world emissions, but 70% of this carbon footprint is basically indirect in the scope 3, related to supply chains. And only about 25-30% is related to scope 1 and scope 2 emissions, in which we have some specific problem with two kinds of drugs, which are anesthetic drugs and inhalers, which use fluoride products, so they have a huge carbon footprint as a group of drugs. They are not, of course, not a huge amount of the percentage of emissions of a country, or not even but it's about the 5% of the any health system emissions. So when we're talking about, before going into the specific things, I want to comment the framework we are using in the decarbonization of the health system. So on the one hand, we have that national health systems do one thing mainly, which is protect the health. And we know that the climate has a lot of impacts on health. So we would say that health system has kind of an ethical commitment to decarbonization. It is related to the ethical commitment that every doctor has, that first, do not harm. Okay, so we have to decarbonize as soon as possible. On the other hand, we must have in mind that a health system has a very important social function, even it has 5% of the emissions, and we know that people is very concerned about their own health, and they don't even want to suspect that their health could be in risk due to environmental concern. So with these two things in mind, we need to decarbonize, but we have to sorry? Yeah, also build resilience, but we talked about a kind of careful decarbonization. We basically talk about 5 principles in which national health system has a significant but indirect carbon footprint mainly. National health system must lead by example, because this thing that we are trying to protect the health of the people. There are other sectors where progress can be made faster without so much suspected risk. I mean, a lot of times we talk with people in the hospitals and they are comparing their footprint to cars, and they say, okay, so remove cars first, probably. But we don't need to stop the decarbonization of the health system, and we need to patient care quality to not be in risk, always safety first, and finally we need to stress a lot of co-benefits of health and decarbonization, both in the global system, but also in the hospital facilities. And that's basically what we are working on, and maybe later we can discuss the specific measures.
Thank you very much, Hector, and thanks also for raising this important point about not having to sacrifice the quality of care that we are responsible to provide and protect the health of our populations, and making sure that those decarbonization efforts really are contributing and are integrated into this main goal, that is provide the quality of care and continue having health systems that are performing as we need. Because basically in WHO we are finding the same. We have been working with many countries who perceive that maybe we were sacrificing quality of care towards decarbonization, and that we were putting kind of a blame in the health sector when this is not the case. So thanks for raising this point. Philippine, you are working in ECODES, and I understand ECODES has a long history in working on climate change, both adaptation and mitigation. And I would like you to tell us a little bit of your experience working with the Ministry of Health in Spain. How have you been doing to basically maybe provide specific tools to decarbonize? I know that you've been working at healthcare facility level. Maybe do you want to tell us a little bit of that?
Yes, thank you, Elena. I can always say that it's a pleasure to work with the Health Ministry. We are really grateful of this cooperation. So, yeah, to put it simply, ECODES is a foundation working in Spain on all kind of societal transition. And in COP26 in Glasgow, we saw this new pact on health and climate action. At that time, it was a Glasgow health commitment, I think, and we saw all Spain committed to net zero objective for 2050, and we decided in ECODES to try to work on that. It was totally new for us, so we launched an initiative called Sanidad por el Clima, or Health for the Climate, to put it simply and in English. And we also decided last year to join ATACH, which is an alliance of health sectors and mostly countries. And so we are really committed to this transition because, as Hector said, it has a good potential for societal transition. Even if it's not as intensive as steel or cement can be, it's still a good share of emissions. And to do so, we decided really to work on the implementation, to work on the daily life of hospitals' practices. So this is what we offer to the government. As you may know, the competence of health in Spain is regional. It's not national. I'm sure Hector could tell you a lot about this, and it leaves its own difficulties, but also some opportunities. And so this is why we try to work with every communities, every region in Spain and every hospitals to really see how can we implement climate action from the start of decarbonization. It means calculating the carbon footprint, which is not an easy thing to do because of data, because of access and capacities. Up until doing this capacity building for people to really know what is climate action. I want to repeat myself, but climate action is not just calculating the carbon footprint. And then we also do some good practices, because what we know right now is that there are many good practices and best study cases, but they are not still all implemented within the decarbonization roadmap. Thank you.
Thanks so much, Philippine. Then I will go to my next panelist, and I think it's great to have a representative from Healthcare Without Harm. I think Philippine already mentioned the COP26 health program, the initiatives that were launched there by the presidency, the first presidency, to have a proper independent health program under the UNFCCC negotiations, and Healthcare Without Harm was a key partner bringing those efforts together, working with the UK presidency, with WHO, and basically pushing countries to engage into this effort. Can you tell us a little bit about the experience that Healthcare Without Harm has been gaining over many years, working with health systems and healthcare facilities and supporting them to decarbonize? Can you share a little bit of maybe lessons learned, experiences, priorities for the future?
Firstly, thank you, Hector, for inviting me to this discussion. It's been a pleasure listening to your answers. Healthcare Without Harm has a long-standing tradition of working with both health systems and health facilities. We have several projects where we aim to both decarbonize health facilities and health systems. And we recently summarized the lessons we learned in the field. And if we start on a global level, a few years ago, we created a global roadmap for healthcare decarbonization. Here we identified 3 different pathways to decarbonize health systems. One was to decarbonize health facilities. The second one is to decarbonize the supply chain. But we also need to decarbonize the wider health-related sectors. We cannot only focus on decarbonizing facilities alone, making them more efficient. We need to focus on transforming the supply chains and rapidly decarbonize every related sector while ensuring high quality care. And in Europe, we are seeing the rise of health systems taking action. The systems are creating decarbonization roadmaps, they're creating scenarios, or creating trajectories for the future. But they're also creating structures for measuring and reporting emissions, providing in-depth guidance on carbon management, and creating multi-regional carbon procurement strategies, while others are even incentivizing performance by allocating parts of a budget based on how you perform in the environmental area. While others are trying to actively collaborate with the supply chain in both measuring emissions and in reducing emissions. However, I also want to emphasize something that we haven't talked about just yet, but I think it's a key component, something we need to discuss, and that is the importance of healthcare professionals. That is why we perceive that the best practice is to combine both bottom-up and top-down actions. We need health professionals and health systems to act. Health professionals can enable new low-carbon means of providing care. And that is also why it's so important to share best practices and also build the capacity of health professionals. And when we look at our programs, now I'm going to mainly talk about Operation Zero, which is a program in Europe where we have a vision to create decarbonization roadmaps for each country in the European healthcare sector. And in this context, we are seeing a lot of great initiatives, but they often exist in silos. It's utterly important that health systems come together to share knowledge and experience, because there is a growing wealth of resources that exist both to tackle decarbonization and in creating resilient health systems. And while the state of knowledge of health systems is increasing, especially when it comes to decarbonization, it is very important that we use these structures for decarbonization to build resilient health systems as well. We need to increase climate risk and vulnerability assessment, create management structures, share best practices, and create networks and empower healthcare professionals. And if I were to conclude, I think that the health sector is the first responder to climate change. And we also need to be on the forefront of climate action.
Thank you very much. You will have another question. Hector, I think, at least in WHO, we are very happy to have you now as direct counterpart just working on climate change and health in the Ministry of Health Spain. I think that's a great achievement. And since we are talking about adapting national health systems, I would like you to tell us a little bit about this huge development that is the Climate and Health Observatory that Spain has launched. There are few countries that have an observatory, and I think this is a great opportunity basically to understand and address the key health risks from climate change. Can you tell us a little bit about this?
Sure. The Health and Climate Change Observatory was created like a year and a half ago by the Ministry of Ecological Transition and the Ministry of Health. It's basically a coordination body between different ministries. Basically, the most important ministries in public policies in climate and health, the Ministry of Health, the Ministry of Science, and the Ministry of Ecological Transition, in order to coordinate and share our policies and share our knowledges. We basically are working at the level of adapting adapting the health system to the impacts of climate, and putting the focus on how important is climate to human health, and also, of course, animal and planetary health, so to speak, in this One Health approach. In Spain, when we talk about the impacts of climate on health, we are basically talking about heat, not only, but it's the most important impact. We have about 20 to 40 direct deaths by heat stroke, but we are between 2,000 and 4,000 deaths every year of vulnerable old people due to heat waves, and about an average 10% increase in hospital admissions during heat waves. So this is basically the most important thing we are doing right now. We need to build what we call a culture of heat. It's an approach in which we're working with a framework of concentric circles, in which we need, for example, mostly cities and towns to make structural changes in how they are built and how they. I mean, we need to make greener and cooler and healthier cities with more green spaces, with less cars, reducing the heat island effect. We are very interested in building kind of community adaptation. We know that this is not only a thing of self-protection. We need people to care other people, especially vulnerable people, but not only. We know we have evidence from a lot of heat waves in Chicago, the historic 1995, I think, heat wave in Chicago, in which the more dense are the communities, the more people are responsible for other people, the less deaths during the heat waves. And finally, of course, we need this self-protection. So it's that people need to know what they have to do during a heat wave and when they have to do it. So we are putting a lot of effort in developing this heat culture. For sure, we are working to improve our heat warning system, trying to predict better when heat is worst for health, and trying to communicate better to people. But we need to have this, greater approach of telling people it's not only taking care of themselves, but in pushing for changes, policy changes, and also these communities. And on the other hand, we recently had this terrible catastrophe in the southwest of Spain. This probably the first and worst climate catastrophe in Spain, with 2018 deaths due to huge floods in Valencia, in the southwest of Spain. This has been mostly an emergency situation, and we have some problems with public health, but they are mostly related, the deaths and the people is more related to the catastrophe itself. But we are expecting, for example, a surge in mental health affectations in the region in the coming months and years. So we are now from the Ministry of Health, we are working in some kind of emergency group of intervention groups on mental health in the field, and of course this is kind of any emergency, but we want to have a special advising group on climate for these units of intervention, because we think that they are in some ways they are as every other kind of emergency, but due to the recurrence and how to speak about these things that is going to be more frequent and more powerful each time, we need to an special approach in climate-related emergencies.
Thank you, Hector, and thank you for sharing all these details about the heat health action plannings and how you are working at community level. I really like also that you brought the point that not everybody is the same in terms of vulnerability, and that you really need the community to understand the risk, how they are exposed, to be able to protect the population. I think it's also very important the point that you raised about the mental health. This is something that we are also observing at national and at global level, because as countries become more aware about the interlinkages between climate change and health, we are seeing specific priorities coming high in the agenda, and mental health is one of those. So I think that maybe this is linking to the point that was raised before about the need to build the capacity of the health workforce, not only to respond, but to also understand what is coming and what is going to be the interventions and the specific access to the vulnerable population that they will be having to promote. Thank you. Philippine, can you tell us a little bit about ECODE's experience working with different sectors and how easy it is to make sure that there is a efficient collaboration between different sectors, maybe the health sector, the environmental sector? I don't know. Can you share a little bit about that?
Yes, totally. Thank you, Elena. So as I shared before, we are seeing day to day some pretty big challenges into doing decarbonization in hospitals and health facilities and health systems. Because of a lot of things. I told you about capacities, I told you about lack of data, but also lack of tools. We need more on scope 3 emissions, we need more tools for each health department within an hospital, because they all have different actions and necessities. Without that, we can't build an emission baseline, so we can't really have a target and a progress towards decarbonization. So it's all a work on progress, and I'm pretty optimistic that with the help of the government and the ministry, we can do it. But I really want to emphasize on the idea that it's not, we are not starting from scratch. We already are doing a lot of things, and we don't need to reinvent the wheel again and again. We have a lot of good practices. We all know about UK and those are doing good, Norway, Belgium, Canada, and so many more countries. I think Spain doesn't have to be ashamed of its work either. And we already have a good ecosystem of professionals and solutions into creating more resilience and more climate-friendly health systems. But what we really need right now is a systemic and holistic approach, because we are all working a bit towards some goals. It can be intermediate targets sometimes, when we have an emergency or when we need to confront to the day-to-day reality of an hospital, but we can't forget the 2050 targets that are our real objectives, and we can't forget that we have the future doctors that are still learning and that can create more capacities on climate action and on resilience. We have the College of Medical Association that are here to validate some solutions that are already existing. We have the industry, pharmaceutical industry, working into this solution. We have scientifics working into creating these solutions, and we also have the doctors, the medics, working day to day with the patients. And I will just finish by quoting one person from Spain. He's called Pedro Cabrera. He's the president of one of the medical associations in Spain, and he's always saying that, so sorry for, for quoting him. is always saying that doctors are the most valuable influencers. They are launching day to day more than 100 or 1,000 messages, health messages to people, and that are reaching people. So we need them to not only be health influencers, but also climate one. And with this being said, I think we are doing a great work. Thank you.
Thank you, Philippine, and thanks for being optimistic. I think we need to. And just to mention, I was also talking, for example, with representatives from NHS, England, and they are surprised about Spain and how good it's going, how fast it's moving, and the seriousness of the commitment. So basically, as a Spaniard myself, I'm very proud of Spain. So, but I think it's important to make sure that we all understand that small steps are the important ones. The most difficult is to start, and then things will be coming faster. To you, we go back to you. Can you tell us a little bit about which are the priorities you see for advancing towards a real integration of adaptation and mitigation efforts at healthcare facility level?
That is a complex question. I think there's a momentum, and it's growing, and we're especially witnessing it in Europe, both from health facilities, health professionals, and health systems. We're getting increasingly contacted by health systems, both on a regional level and on a national level. So there is a real drive, but there are lots of challenges ahead as well. Health system or ministries of health have traditionally not worked with carbon management. So there's a need to build the capacity basically of ministries of health. And there's a lot of new roles that needs to be created that haven't existed before. But we're seeing them rising, which is a great sign, of course. But in our projects, to ensure the integration of both, we also need to create frameworks for integrating them. And right now, we're actually on the verge to publish a new guidance on building health system resilience. But I think for the future, we'll have to work on creating larger synergies between decarbonization and resilience. And in a lot of cases, we might there are instances where these two don't align. One example we often talk about is ventilation or AC, but there are also other options such as passive houses. So we need to find these synergies moving forward, and we also need to focus on building the capacity again of healthcare professionals, while also providing guidance and leadership on a system level. Because I know that a lot of the healthcare professionals I meet, they really want to make a difference. But usually, a healthcare professional might balance several different roles, meaning that often there isn't enough time for it. That is also why we need to invest and finance health facilities in their decarbonization journey. We need to bring together different specialists on a facility level to ensure that, as we talked about, all of the different scopes are covered. But we also need to share the solutions between different health facilities, because when I look at Europe, and as I mentioned earlier, there's a range of solutions out there. There's a lot of facilities working directly to reduce the emissions of the supply chain, but these facilities are usually working in their own system, and we need to scale these solutions. And the only way forward to do that is to invest in the capacity of healthcare professionals.
Thank you very much. I think I will make another question to you, and then I will open to our amazing participants. Hector, you mentioned before that you are also working on the supply chain. Everybody knows healthcare without harm, ECODES, WHO, that this is the most complicated thing to do at health systems and healthcare facility levels, because again, there are maybe decisions that are taken outside of the health sector that is difficult to influence. For example, energy access, fossil fuels that you may have to rely on, efficiency mechanisms or systems that are not really put in place to make sure that you reduce your emissions and who you buy your products from. Can you tell us what Spain is thinking to work in the supply chain?
Sure. Well, what we have already done, and it will be public in a few weeks, I think, we have introduced the environmental impact of drugs in the new reform of the drug law. This is a huge reform that, it first changed since 20 or 30 years. That the first great reform of the drug law, including the approbation, all the life cycle of a drug, from approbation to pricing to pharmacovigilance, and we have introduced the criteria of environmental impact as a definition, as something that people has to take into account across this life cycle. So at the moment, for example, except in approbation, in the approval of drugs, but during the pricing in order to decide if a drug has to be, you can buy freely or it has to be prescribed, for example, this is going that the professionals, they can take into account. They are not going to be, we are not going to make it mandatory, but we are working for in order to be another criteria. Of course, respecting the quality of care and availability of drugs and safety, but we think that we want for drugs with with higher carbon footprint, for example, if they are another available products, similar products, then they can be more expensive, for example. And also this, not only the carbon footprint, but also the pollution after the use. And I think we are very proud of this, and now we are in the most complicated task of trying to develop kind of environmental impact standard with other countries. I think we know that the NHIS in the UK is working on this. We have a meeting here, and we are aware that this cannot be each country, its own standard, has to be a global or a European policy, so to speak. And then the other thing we want to do is help the health professionals to do green procurement, because in Spain we have as every country has a very complicated public procurement law, in which you can introduce green criteria in the procurement, but it is not always clear how to do it. So I think that we need to be clear. We need to help the people who want to do it, the health professionals, but the managers of the people who buy the things in the hospitals, which is the best way to do it and which are the best criteria. Because one thing we are observing with the health professionals is that they are willing to help, but they don't really have very clear which is the most important thing to do. So some people think is, for example, in the procurement is electric cars, and other people is transportation by electric cars in the final mile, or the people thinks is the waste, and this is the boxes of the things they buy. So we need to do this analysis and tell people, okay, no, and as we have, Spain is a very decentralized country. We have actually 17 regional health systems, and the companies they sometimes complain with some reason that if every region has different green criteria, it's very hard for them. So we want to put coordination and cohesion, which is what the Ministry of Health in Spain has to do, to say, okay, let's try everybody to go in the same direction according to green procurement. So we made it easier for companies to adapt, and we are working in the low-hanging fruits, and not in something that some people think have a very high impact in the environment, but they really don't have. For example, I don't have an example right now, but it usually happens.
Perfect. That is amazing, everything that you are doing. And I think it's great to see, because again, at WHO we are exposed to things that are happening from different fronts. For example, the same discussions are coming also from the private sector. They realize this is a priority now by many countries. They are saying that they are going to do much more, they are committing to do much more, but I think the point that you raised that you need to be together, to have the same standards, to be aligned on the standards and the criteria that we are also going to promote. WHO is also working with the regulators of medical products, trying to push also for these environmentally sustainable criteria to make sure that this is coming again in an aligned and integrated manner through all of the fronts. So really, I'm really surprised about everything that you're promoting. It's amazing, and we would like to continue knowing more about how this is about advancing. Please, tell us. Do you have any question, anything to share with us that you would like to know, maybe from the...
Oh dear. Actually, yes. So I know that the recent flooding in Valencia shocked the world, and I'd like to offer you my deepest condolences for the severe loss of life that happened. And I'm wondering, as I understand why extreme heat is a major focus in Spain right now, but I'm wondering, since we know that once in a century floods is not a reality anymore, what are some lessons learned and leadership that Spain can provide for future extreme weather events that are unexpected? My name's Sue-Ann Bell. I'm a professor at the University of Michigan, and I'm here with the Alliance of Nurses for Healthy Environments.
Well, so, I mean, in Spain, the emergency system does not is not related. It does not depend on the health system. So there is a lot of things to learn from the Valencia catastrophe. From the emergency management point of view, the first one is we need to follow what the scientists are saying, because I mean, in Spain there has been probably in this concrete example has been problems with some politicians or with some organizations not taking into account what the scientists were saying about the magnitude of the flooding. This is the first thing to do it, and we, for example, saw it when we were developing the changes in the heat warning systems. For a lot of people, it's like if you raise too many red warnings, some people complain, because obviously sometimes you fail. I mean, you see that there's going to be a lot of heat, or there's going to be a big flood, and then doesn't happen, or happen in another place, or wherever. So, and this is something that politicians, I myself a politician, we need to take into account that we cannot take risk with this. It's better to make more warnings, even they are false warnings in the last moment. And then also we need to make people aware about the problem with this kind of extreme events, because the problem, another problem in Valencia is that it was a huge event. Some people in Valencia they usually have this not floods but a lot of raining sometimes after the summer. The gota fría, they have even a name, but this was like 1 in 1,000 years. So, for example, when the warning was when the government sent the warning, a lot of people come to their cars in their garage. A lot of people was killed or dead because they were thinking there was a usual flood, like this kind of flood, not the amazing thing, what the catastrophic thing there was. And so we need to prepare people to see, okay, we are now moving in a unknown world, unknown direction. And finally, from the public health, we for example, I don't think we have, I mean, they are like specific events, and I think we have never had since a lot of years this kind of catastrophic flooding and all the problems we have now with the sanitation systems, which is completely destroyed in some towns. And it's, the other day we were discussing what is going to happen, and the basic things of environmental health is the use of the sanitation systems since the 19th century. And some towns in Spain, they are moving to 19th century when you haven't a proper sewage and sanitation system. And we are now we are working with WHO, with the specialists in the WHO in water management and sanitation management, and we need to learn the lessons. So we are going to preparing a report in case this is happening. But we are obviously analyzing the water and taking it because taking into account this vector-borne disease. Luckily, we are in November and Spain is cold, so probably we are not going to have a lot of problem with mosquitoes, but this could be a huge problem in another situation. And that's probably the most three important things. Pay attention to what scientists and world weather organizations are saying. Make people aware of the risk of the new climatological events, which are beyond the scale of what they know. And finally, these things that be prepared to after the catastrophic events and learn the lessons of these wildfires or floods in this case or whatever happened.
Thank you.
Sorry, Elena, can I add something? Do you mind? As Icodes, we were also very shocked by this event, and what we learned from the civil societies that maybe can add to what Hector just said is that we need to learn more from other countries that are already facing these traumatic events and catastrophe, to see how can we mobilize more the communities and people that are living that. I know that a lot of countries are especially working on gender, saying that women are the prime victims, but also the prime actors and stakeholders to prevent this kind of event. So I think we have also a lot of lessons to learn from other countries and for the civil society. Thank you.
Thank you very much. Maybe I will also add a point. I was in Mozambique the day after the passage of Idai. And as you know, it was a huge catastrophe. And I was shocked because we were talking with the Ministry of Health and they were telling us, no, we are part of the Disaster Risk Reduction National Committee. And we got the warning. We knew this was coming, but we didn't understand the magnitude of the event. So for example, I think they said we were ready for the magnitude of the wind, but we were not ready for the magnitude of the water that came. And I think something that is very important is to understand that these sectors, health and emergencies, sometimes they speak different languages. And we really, and med services, we really need to invest in these communities to understand each other and to understand the process so that they are ready to know what needs to happen. Because in the case of Mozambique, in any case, it's very difficult to get cholera vaccines. But I think they thought, okay, this is going to imply that we need 300 vaccines. They needed 2 million. So there was a huge cholera outbreak that then killed a lot of people. So that is also something that is very basic, but super important when something like this happens, because then the Ministry of Health and the health community need to understand how they are going to approach these populations that are going to be affected by all of the hazards that are coming with these warnings. I have other STEAM participants here. Do you have a question?
Hi, my name is Charlotte McCardle. I'm Deputy Chief Nurse in England, and so I have a couple of things running through my mind. The first is, I think in Europe we're becoming more aware of issues like have happened in Spain. So I think the learning and what Hector was talking about how the Spanish people responded or didn't respond is really important for us in Europe to really educate the rest of the countries around the management of the immediate disaster and also the impact that it has on local communities. And the second thing I was thinking is that if people are not heeding the warnings, and they may now as a result of heightened awareness because of what has happened, but healthcare staff, and particularly, I should have said, nursing, are their most trusted profession, have been for a long time, and they are a group of people that can get those messages out. They tend to live and work in the same community, so their community trusts them, and maybe there's an opportunity for us to start to engage our clinical team, clinical staff, doctors, nurses, etc., in getting those messages out to their communities. And the third thing I was going to say was around the procurement. I'm glad that you're meeting with colleagues from NHS England, but we have a senior nurse who leads clinical procurement in England, and we've been doing quite a lot of work around your point about engaging clinical professions, and a number of really good work streams. And it isn't, and you said about, Elena, about people thinking if you're putting climate before quality, and you're actually, it's what I'm seeing is the complete opposite, where you're seeing people focused on transformation of healthcare, because all our health systems are under pressure, and we're asking them to consider carbon reduction as part of that. What we're seeing is better value for money, better patient experience, better staff experience, and lower carbon emissions. So I think when we frame it in that way, it helps people to make the change.
So I will put you on the spot because I already thought with the first intervention, nurses, we all know you are the most trusted professional, more than doctors. So I have the chance to lead this Alliance for Transformative Action on Climate and Health. It's been a lot of meetings, a lot of global work. Something that we really want to do better is to involve all of the health professionals to make sure that you help us to drive this agenda. So basically, even just if you are able to give us a case study on how you are contributing, on the positive changes that you are seeing, how the nurse community can really help us to advance this agenda, would be super useful. So this is a request. I will be happy to talk to you later. And maybe we can organize a meeting, something, I don't know.
That would be fantastic. And we have loads of examples. My colleague Imogen here was a clinical fellow on the Green Year programme, and she's led some work. But we now have a network in England for nurses engaged in this, and we're supporting them with training and education to help. And it's all the small changes that make the big change.
Fully agree. Thank you.
In Spain, in the Ministry of Health, we had, I don't know if the position is official, but a kind of chief nurse officer, and she was working also with the climate network of nursing, and because she was very aware, she had to left. Now she's an MP, but she's going to be. There's coming another nurse to work as she was, and she was very aware of the very important role of nurses, both as communicators and influencers, and of course, and also what they are, one of the professionals that, for example, they are that work more with the things, and that also get with the waste. So, and she was very aware of, okay, we have to imply them into the reducing the waste, recycling, something like that, and this is a critical role for the nurses. Of course, everything, but she was all the time was telling us we have to work with them. So that's.
I think we have another question there, and then we will be closing. Yeah.
Hi, I'm Sergi. I work in Ferre, the pharma company in Spain. I was very interested in what you said about including all these environmental criteria in all the process to register a pharma product. I just wanted to know more about these criteria, specifically in the climate part, and also if these requirements are designed in a product perspective, or it will require also in a more broad sense, so the companies has to implement a climate strategy, and this will be mandatory for any supplier of the system. I would like to understand if it's really product focused or it's also company focused.
So we are aware that by now it's very difficult to have a product level requirement of carbon footprint. So we are also introducing the Pro Pharma plan, which is, in Spain, pharma companies has to pay to the state a percentage of all the drugs they sell. So we are introducing this more broad criteria at the level of the company. We want to do it. We are working with the Ministry of Industry to introduce these environmental criteria in the Pro Pharma. So companies that are greener, they are going to pay less. But our intention is, in the long term, to introduce product-level criteria of environmental impact. This is not easy. It's not clear how this thing I was talking about developing the standard. But we think that, and in the short term, it probably is going to be at the company level. So they are not going to be mandatory. We will like to make mandatory for companies to have a carbon decarbonization plan as the NHIS has in order to sell everything, but we don't know if we can do it. But the idea is that we left to the professionals that put the prices and do the prescription to have into account the environmental impact at the short term of the company and then of the drug.
Okay, thank you.
Any final question? Intervention? No? So I think it was a great panel. And I really appreciated also your interventions. So thank you very much. Bye.
Thank you.